Morning, everyone. Welcome to the Hospital for Sick Children. My name is Dr. Michael Apcon. I'm the President and CEO here at Sick Kids. I'm delighted to welcome Dr. Eric Hoskins, the Minister of Health and Long-Term Care, and our local MPP, Han Dong, to Sick Kids this morning. I'm also pleased to welcome a number of guests. James McCracken, who's the board chair of the Ontario Hospital Association, Dr. Gary Newton, President and CEO of Sinai Health System, Rob Howard, the President and CEO of St. Michael's, Dr. Dallas Seitz of the Renal Network, Connie Dajak, President and CEO of the Runnymede Health Center, David Wormald, President of St. Joseph's Health Center in Guelph, and colleagues from the Toronto Central LHIN. I also want to give a special welcome to one of our families, Kyla Austin, whose daughter Talia is currently being treated here at Sick Kids for cancer. Sick Kids has a proud history of delivering high-quality, safe, and family-centered pediatric care to the children and families of Ontario, and is very proud to work with many of the hospitals and community partners, some of which are represented here today. The recently tabled 2017 Ontario budget delivered very welcome news to all of us in the healthcare communities. We've been really pleased to see welcome increases to both hospital operating funding and capital dollars. We're pleased to be hosting this funding announcement today to hear further details of that operating funding. Please join me in welcoming Dr. Eric Hoskins, the Minister of Health and Long-Term Care, and the MPP for the Toronto riding of St. Paul's to the podium. Minister, it's a great pleasure to welcome you back to Sick Kids.
Well, thanks, Mike, and good morning, everyone. And I know we're live streaming this today, so for the smart individuals that were able to actually stay out of the rain this morning that are watching and listening, welcome to you as well. And it is, Mike, it's great to be back at Sick Kids. This is such a fantastic institution, which is not only providing the highest quality health care to children in Ontario, but is a world-class institution that is renowned for so many important reasons. Again, the quality of care, but the research that takes place here, the groundbreaking advances in healthcare, pediatric healthcare that are making a difference, of course, in this province, across Canada, and indeed across the world. So I want to thank Mike and the entire team here at Sick Kids for hosting us this morning. As I mentioned, Ontario is very, very fortunate to enjoy some of the finest hospitals anywhere. And Sick Kids is certainly a leader, a world leader, in providing the highest quality health care to our kids. And we want to maintain and even grow that important distinction. So that's why I'm so pleased to announce that as part of the 2017 Ontario budget announced last week, we're investing over $500 million in our hospitals across the province, and that represents a 3.1% increase to the hospital sector. And in the case of Sick Kids, it represents an additional infusion of $9 million this year, specifically to the operating budget, to that base budget that they can rely on, not just this year, but on an ongoing basis. So this investment, the 3.1% increase for hospitals, so if you look at the investment from last year, which was just under $500 million, and this year, just over $500 million, that represents, as I think everybody's done the math by now, more than $1 billion invested specifically in our hospitals across the province last year and this year. And this investment for hospitals will mean more access to cardiac services, more access to critical care, more importantly, more access and greater availability of organ and tissue donations and transplants, more funding for rare diseases, more funding for bariatric services, and indeed with this 3.1% increase, we're also targeting reducing wait times for some key procedures where we know there are challenges that exist either because of our growing population or because of wait times that need to be further reduced. So we are funding 2,800 more hip and knee replacements in the province this year. We're funding more than 2,100 additional cataract surgeries, more episodes of stroke care. We're funding tonsillectomies. We're funding more foot and ankle surgeries, and we're funding an additional 28,000 hours for more MRIs. So when you look at the breadth of where the funding is going, as well as, again, the flexibility that we're providing our hospitals to, because they're the ones that know best how to allocate funds. And so although we're targeting specific areas and wait times, it's important as a government that we support our hospitals to make the decisions that they know are the best decisions for their unique circumstances. So it will mean much needed help for hospitals that have been experiencing really an unprecedented, in many cases, an unprecedented rate of growth in patient volumes, and it will allow them to continue to deliver that high quality care. Ladies and gentlemen, our government understands that we need to continue to invest in our hospitals, and I believe our hospital boards and CEOs and the Ontario Hospital Association understands that I have been relentless in fighting for more and more funding for our hospitals, because as a clinician myself, as a physician, I understand just how important this foundation of our healthcare system is, and that we need to invest in it, and we need to invest in it particularly because of those challenging years that we've faced prior to coming back to balance. Now, ladies and gentlemen, which is sort of a bit of a tangent, but critically important. I thought, given that we're at Sick Kids, I would be absolutely remiss if I didn't talk about an element of the budget of which I am particularly proud, and that has a unique resonance here at Sick Kids, but indeed across the province as well. And that's to spend just a couple of minutes talking about pharmacare, and specifically the measure and the investment in the budget that was announced last week, where we are committed to creating and implementing, as of January 1st of next year, a child and youth pharmacare program. And this is how it's going to look. Obviously, it's subject to the budget being passed, but we're confident that it will be passed. And so as of January 1st of 2018, 4 million children and youth across this province will be able to, if they're over the age of 18, of course, they can go into the pharmacy themselves. If they're under, they'll have to be represented by their parents. But any single one of those 4 million children and youth can go into a pharmacy with a prescription from their nurse practitioner or from their doctor, and they can give that to the pharmacist and get access to the entire drug formulary of this province, more than 4,400 drugs on that formulary today. And thank you. And they can do that without any annual deductible, an annual deductible of zero, without any copayment, so they won't have to pay a single copayment, no fee, not a single dollar. So those drugs will be absolutely free. And because it is the entire formulary for the province, it's going to include cancer drugs, it will include drugs for rare diseases, it will include insulin, it will include asthma puffers, the entire list of medications that's available, the same list of medications, for example, that's available to our seniors, the same list of medications that's available to those on Ontario Works or the Ontario Disability Support Program. So I'm incredibly proud of this, and I know that there's a vision behind it, right? This is an enormous leap forward. I've described it as probably certainly one of, if not the biggest transformation in Medicare in the history of Medicare, to actually take that vision that existed 50 years ago. It wasn't simply when Lester Pearson, well, it was Tommy Douglas that got it all started, as we know, in Saskatchewan, but when Lester Pearson and his health minister of the day, Alan McEachin, who was an MP from Cape Breton, he's the health minister of the day, when they demonstrated the courage to create national Medicare, there were two parts to it, right? There was also the vision that national pharmacare would be side by side. And that's how I look at pharmacare, is that you can't imagine or pretend that healthcare is something that ends with your visit to your family doctor or to a visit in an ER or a hospitalization. It needs to include that critically important aspect for those who require it, of access to medicines, prescribed medicines that may keep you healthy or may get you healthy again. So some of you probably know that I've been nationally calling for pharmacare ever since, well, even before, but certainly since becoming health minister. But I need to and want to applaud the courage, the boldness, and the leadership of our Premier, of Kathleen Wynne, to say we need to continue to fight for national pharmacare, but we need to begin to take the steps necessary to bring universal pharmacare to Ontario as well. And we're going to prove to the rest of the country that it can be done. So, and what better place to start than with vulnerable children and youth? And I think, we at one point had thought that we would strictly focus on the 0 to 18 age range, but then we realized, as we began to look into it, we realized that from that 18 to 24 period as well, it's a very unstable, precarious time. 70% of mental illness, for example, emerges during childhood or youth. Often you have individuals of that age that they're at college or they're at university, and they might be starting that first job, and it's a contract position that's unlikely to hold benefits. So we felt it was critically important as well, for a whole variety of reasons, to ensure to push it a little bit further. So we've created the model. We decided to start with the full list of medicines, the age group that I mentioned, from 0 to until the 25th birthday, absolutely free. So to create a model that we believe is truly universal, that it reflects the universality of the other parts of our healthcare system. And then the big job is to take that beginning, that big leap forward, and keep the vision of total and full universal pharmacare for every Ontarian and build towards that end. So I know that particularly here at Sick Kids, that element of the budget resonates as well with a lot of individuals. But ladies and gentlemen, I'm proud of this budget. I'm proud of the fact that we're increasing the health care budget this year by 3.8%. A big piece of that goes specifically to hospitals. A big piece of that piece goes to Sick Kids to continue to provide that highest quality care. Ladies and gentlemen, you can rest assured that I will continue to fight on behalf of our hospitals to ensure that they get the funding they require to do the job that we've asked them to do on behalf of Ontarians. So now I think I'm going to turn it over to my colleague Han Dong, who is a relentless champion, not just for this riding, this part of Toronto, but also for everything healthcare. And he will no doubt tell you even more, and specifically what this investment means for Sick Kids. Thank you.
Well, thank you very much, Eric. I have to tell you that day in, day out, I watch Eric answering questions during question period. You've done a tremendous job for the province in the last couple of years as the Minister of Health. I have to tell you that the first time in the briefing for the budget, when I heard the pharmacare for youth under 24, in that room, I said to myself, this is truly historic. I mean, this is history in the making. And I have the honor and pleasure being in the same room as someone that really led the creation of Ontario Pharmacare for Youth. Hopefully it will expand, truly be universal to everyone in the future, is very, very special. I want to thank you for, and also thank you for choosing Trinity Spadina, Sick Kids, to make this great announcement today. I want to thank Mike for hosting this announcement this morning. I recognize that there are folks from Toronto Central Ling, and Dr. Gary Newton from Sinai Health Network is here as well. I want to thank you for your good work providing health care to not just residents of Trinity Spadina, but for Ontarians across the province. I'm very honored to represent this riding of Trinity Spadina, where, as the Minister stated, home to many hospitals and world-class hospitals. I want to thank the Minister for the announcement for over $500 million we are investing in our hospitals. With that, I'm very pleased to announce that Sick Kids will receive $9 million in new investment this year. This is a, go ahead, yes. This is a healthy injection that is going to make considerable difference in the lives of children who have come to Sick Kids in time of need. This funding will be directed to priority services like transplants and left ventricular assistance device for destination therapy and cochlear implants. It's also going to help fund recently announced the joint Ehlers-Danlos syndrome clinic with University Health Network. We also know that some of the most stressed moments for parents are when they have to bring their children into the emergency room. In fact, I was telling Mike, my wife brought my son Matthew for a recent visit. He has severe allergy, food allergy. We couldn't figure out what happened to him. They receive great service here. So I want to take this opportunity to thank all the doctors, staff, and nurse at ER for continuing providing that very, very much appreciated service. So this funding will also be used to reduce the time patients spend in our ER here at Sick Kids. The investment today speaks to increasing access to health care for both patients who live and work in Trinity Spadina and across this great province. It will help protect our health care system for generations to come. It will address the health care needs for community that are experiencing rapid population growth and ensure patients and their family receive the best possible care closer to home. It provides much needed boost to the hardworking healthcare professionals who work the front line each and every day. And I want to thank every one of you. As the Minister stated, with a balanced budget, we have more freedom to invest in the things that really matters to people here in Trinity Spadina and across Ontario. Thank you very much.
Thank you very much, Minister Hoskins and Mr. Don. As a caregiver, as a member of our complex care team, one of the most challenging things that we deal with is figuring out how to connect our families to the medications that they need when they're discharged. And I can really see the direct impact that the pharmacare program is going to have on the children that we serve. And as a hospital executive, I think about hospitals as organizations that turn funding into caring. And the impact that this operational funding enhancement is going to have, I can see immediately the impact that that's going to have on the children and the families that we serve here and across the province. At this time, I would like to have the great pleasure to introduce Mr. Jamie McCracken, the board chair of the Ontario Hospital Association and also the chair of the Board of Governors of the Ottawa Hospital. Mr. Cracken.
Thank you, Mike, and thank you, Minister Hoskins, for inviting me to participate today. On behalf of the Ontario Hospital Association, I'd like to thank the Government of Ontario for this vital investment in hospital services and patient care. Ontario's healthcare system is undergoing a period of intense transformation, including a 5-year period of very significant financial constraint. Hospitals across the province are under enormous pressure to maintain and improve access to high-quality service. However, over the past year, and working very closely with the OHA and many hospitals in their own right, the Government of Ontario listened to the evidence pointing increasingly to the need for investments in hospital-based care. The Government has directly acknowledged the pressures facing Ontario hospitals, first in the 2016 Fall Economic Statement, and with a new additional funding increase just last week in the Ontario budget. This investment is an acknowledgement of the capacity challenges hospitals have been facing, and alongside with other investments made in Budget 2017, it also signals a renewal commitment from government to enhancing access to care across the continuum. Thank you again, Minister Hoskins, for today's most welcome news. The OHA and all of Ontario's hospitals, and there's 145 of them, look forward to working with you in the year ahead as we continue with our shared efforts to meet the challenging and growing health care needs of the people of Ontario. Thank you very much.
Thank you, Jamie. I'd now like to introduce my colleague, Dr. Ronnie Cohn, the Chief of Pediatrics here at Sick Kids, to speak about the impact of the PharmaCare announcement on the families that we care for here at Sick Kids, and indeed the children and families all across the province.
Thank you, Mike, and thank you, Minister Hoskins, for coming here and announcing these important investments today. I want to congratulate you and your government for the creation of OHIP Plus, the Children and Youth PharmaCare program in Ontario, which really truly represents the first step to an overall goal of achieving PharmaCare for all Ontarians. And the leadership you have demonstrated is truly historic, as you mentioned. Just imagine you receive the news that your child is ill and that you have to cope with that news, which is difficult in itself. But once you go through the process of trying to deal with this, many of our families, most often with lower income and no extended health care benefits, need to ask themselves the question, how am I going to afford the drugs that are necessary to actually treat this illness? So I think it's difficult to express in words how difficult it really is for these families to go through, and I think the impact of this program based on this, for all the families we have the privilege to take care of here at Sick Kids and across Ontario, can simply not be understated. Last night I was reflecting a little bit over the last few years since I came to Ontario on my practicing time as a physician here, and I sadly realized that I have too many examples to discuss with you today where families really are struggling to afford their care for their children. And as you can imagine, that has significant pressures on the healthcare system overall. For example, we often, far too often, find ourselves in a situation where we can't discharge children in a timely manner because family can't afford the drugs they need to give their children to treat the disease. That, as you can imagine, increases length of stay, increases the pressures on the healthcare system. We have data accumulated from scientists here at Sick Kids that children with asthma have to come to the emergency room far more often than necessary, sometimes have to be even admitted to the hospital because families cannot afford the medications they need to give them at home or in the community to keep them out of the emergency room and the hospital. But I'm going to end with an example beyond the healthcare system to illustrate the individual impact your vision had. About 3 years ago, I saw a 5-year-old boy in my clinic who came to see me because he was not able to run as fast as his peers and he couldn't take the stairs up. And after some investigations, I had to disclose the news to the family that he has a very severe neuromuscular disorder that eventually will lead for him to lose his ambulation, sit in a wheelchair. And since this disease also affects his heart would be failing at some point. And while there is no cure for this disease yet, although the rare diseases are on your mission too, which I'm very grateful for, there are lots of medications we need to give to these children to keep their quality of life as high as possible and to prevent the heart from failing. And after the family was trying to cope with the diagnosis, they went through the situation that they couldn't afford the drugs. Both parents had to take extra shifts at work. And last Friday, the mom called me. And she simply asked me, is this really true? Is this for real? And I said, yes, it is. Because she said, we will be able to work less shifts, can spend more time with my children, and I may take my husband out on a dinner date for the first time in 3 years. So, Mr. Hoskins, MPP Dong, on behalf of all my colleagues here at Sick Kids and most importantly the families we serve for, thank you for your bold and visionary leadership and for truly making a difference for the lives of the families we take care of here and all over the province.
Thank you, Ronnie. Thank you, Minister Hoskins and MPP Dong, and thank you to your government. We're really delighted to have the opportunity to host this announcement here today at Sick Kids. There's these much-needed investments in hospital operations allow us here at Sick Kids, and as well as our peer hospitals across Ontario, to continue to provide high-quality care to our patients. And I think I speak for all of my colleagues here today when I say that these investments also increase our capacity to respond to the growing demands on the healthcare system and to continue to innovate to meet the healthcare needs of the next generation of Ontarians. Minister, I also want to echo Dr. Cohen's comments. We're delighted to see the province make a commitment in Budget 2017 to one of the most important OHIP expansions in a generation. With your commitment to free prescription drugs to everyone under 25, it really is a remarkable announcement and something that's really, I think, going to be transformative for the families that we serve. As Dr. Cohen has illustrated, this is going to have a really significant positive impact. Many of the families that we care for are struggling with the stress of having a chronically ill child, including the stress of having to figure out how to afford the prescription drugs that they need. As I noted in my introductory remarks, we're pleased to have one of our families with us today, Kyla Austin. I just want to acknowledge her being here, who's representing her family, and her daughter Talia, who is with us on our 8th floor. Your government's funding commitment to health care helps us deliver the best possible care to Talia while she's being treated here at Sick Kids, as well as helping families with the cost of medications, including simple things like antibiotics to manage infections, as well as the more costly and complex medical regimens for treating kids with cancer and heart disease and other rare diseases when they're discharged from Sick Kids. On behalf of these families, as well as all of us here at Sick Kids and across the healthcare community of Ontario, I just want to again say thank you. And thank you to everyone who joined us today for today's announcements. This is the end of our formal part of the morning's program. I do believe the Minister will be available to take media questions adjacent to the podium here. Thank you.